This podcast contains our own personal views not associated with any organisation. Coronial contains descriptions of death inquests that may be graphic and disturbing to some listeners. Discretion is advised. Hi everyone and welcome back to today's episode of Coronial. My name is Emma.
I'm Georgie.
I'm Alice.
A little bit of a warning before we get stuck into today's episode. It will involve discussions of alcohol dependence and excessive alcohol consumption. So if that is something that is not for you, then suggest that you don't listen to this episode and we'll catch you another time.
Additionally, we've had some technical issues with our recording for this episode, so we apologise in advance if things are not to our standard quality.
So today we'll be taking a look at the coroner's report into the death of Kathleen Dawn Arnold, who was 30 years old when she died in September 2023. So this is a very recent report. It was only handed down on the 11th of February 2025.
Yeah, wow.
So as of the time of recording, that's what, like 3 weeks ago?
Yeah.
So it is a very fresh report, and the reason that I found it was because there were a few news articles. And I think contrary to what I said maybe in a previous episode, this one I was particularly interested in the recommendations because I think they're very topical rather than the actual, cause of the death. Because I think there are some interesting recommendations and something that's like very topical and going to become more and more topical as we go on as well.
Okay.
And yeah, something that I can also see sort of continuing, like issues that I can see continuing unless there's some sort of governmental intervention that happens well into the future. So, yeah. So as I said, Kathleen was 30 years old at the time of her death and she was living in Heidelberg, Victoria with her mother. Kathleen had a long history of heavy alcohol consumption. While in high school, she would party and binge drink frequently and her mother had to contact emergency services on a number of occasions because of it. During her 20s, Kathleen received support for numerous conditions relating to her alcoholism and other diagnoses. In 2017, Kathleen had started attending a local Alcoholics Anonymous meeting group. Between 2012 and 2022, Kathleen had approximately 50 presentations to local hospitals. So that's in a 10-year period, the majority being for alcohol and drug abuse issues. During this period, Kathleen would consume large volumes of alcohol daily and would try to conceal her alcohol use. There were periods where Kathleen was able to stabilise her alcohol consumption. However, on each occasion, she returned to consuming alcohol. On the 25th of August 2023, which is approximately 3 weeks before she passed away, Kathleen's mother found Kathleen unresponsive on the floor. She was transported to the local emergency department where her blood alcohol concentration was measured at 0.474.
Oh, we've talked about this.
Yes.
0.3 was the cutoff?
0.03 is where it's considered potentially lethal.
0.03 or 0.3?
0.3, sorry.
0.3, yeah,
yes,
okay. Yeah,
is the level where it's considered potentially lethal. Of course, with someone who consumes alcohol on a daily basis, their tolerance, I'm assuming, is
higher.
a bit higher.
Okay, so it's not necessarily lethal for her based on her background.
No,
I mean, clearly because it didn't at that point.
Didn't at that point, but it's still extremely high.
Yeah.
Following this incident, a drug and alcohol clinician met with Kathleen, who declined their services and indicated her intention to cease alcohol consumption and attend Alcoholics Anonymous meetings. So during the morning of the 15th of September 2023, Kathleen walked to the local shops and purchased various items, including 2 bottles of wine. According to Kathleen's mother, Kathleen had been sober at that point for approximately 4 days.
Okay, so that admission had led to an attempt, presumably not a first, it wasn't a first attempt, but a new attempt at attempting sobriety.
That's right.
Okay.
At 11 a.m, a passerby saw Kathleen collapsing on the street and drove her home. Her mother helped her into bed, believing she had consumed one of the bottles of wine. Her mother found the other bottle of wine and poured it down the sink. At 5 p.m. that afternoon, when her mother left home, Kathleen was awake. Shortly after 5 p.m, Kathleen travelled to a nearby store where she was captured on CCTV purchasing a bottle of spirits. At 8 p.m, Kathleen's mother returned home. Kathleen was semi-conscious and unresponsive. Her mother found half a bottle of vodka in Kathleen's room, which she took away. Kathleen's mother then went to bed at that point.
Oh, that's challenging.
This is what she does. It's been a decades-long issue.
Yeah. So she's just at this point trying to reduce the risk as much as possible, but she's not able to actively really strongly intervene.
No, and her daughter's 30 years old.
Yeah, and as you said, it's been a decade.
And we'll go through some of the stuff that her mother's tried to do.
And it's probably the recommendation for her, like the mother's own health as well, because again, how much can the mother get involved? But I'm just like, that's such a tough situation to be in.
It is, yeah, and have a lot of sort of empathy for the mother, because that's a really hard thing to be dealing with, having a grown child, seeing that destroy their lives, and it'd also be all-consuming for her as well. I mean, she's obviously still going out and doing things, but you'd probably even get scared, like leaving the house.
Yeah.
Doing her own thing.
Be away for too long.
No, exactly, because you just don't know what's going to happen in that time. So the next morning around 7 a.m, Kathleen's mother found Kathleen unconscious in her bed. She called emergency services and at the call taker's direction, she started CPR. When the paramedics arrived, they declared Kathleen deceased on the scene. An autopsy was conducted by a forensic pathologist. The examination revealed fatty liver and pancreatic calcification. There was also consolidation in the left lower lung and other lung markings, which I don't know how that's related to alcohol use.
Like aspiration pneumonia?
She's deceased and she probably had a period of time where she was not breathing particularly well.
Right.
Or like respiratory suppression.
Mm-hmm.
So her lungs wouldn't have been expanding as normal.
Freely, yep. So toxicological analysis of the post-mortem samples identified a blood alcohol concentration of 0.54.
Wow.
Yeah, so higher than the 0.47.
Does that change after you
Yes.
pass? Okay,
so
anyway, go
they
on.
also took a sample of vitreous humour, which is the clear gel that fills the space between the lens and the retina of the eyeball. That was tested for its ethanol concentration, which was 0.62. And generally, toxicological analysis of the vitreous humour provides a better indication of perimortem level than postmortem blood. So it's likely that it was higher than the 0.54.
Oh, I was expecting it to go the other way.
No.
Yeah, wow. Okay, so it was actually higher.
0.62.
Wow.
Yeah.
Wow. Okay.
I'm just trying to figure out how you get it that high.
But also she was unconscious when the mother went to bed. So it's like, did she...
She wasn't unconscious.
Sorry, she was asleep. But I assumed drowsy and likely to just sleep. And so that therefore indicates that potentially she actually woke and consumed more alcohol. And I'm like,
Yes.
How did she do that in that state?
This is what we're going to go into. So the medical cause of death was ruled as acute ethanol toxicity on a background of chronic alcoholism. Kathleen did also suffer from depression and she did have suicidal ideations, but there was no evidence that her death was a result of a suicide attempt. There's no suicide notes, no sort of indication directly prior that was something that she was.
And this was not a unknown, unexpected level of like alcohol consumption in that context of like, it wasn't like she'd been sober for a really long time and then went out and consumed a really heavy amount that therefore suggested there was intent behind it. This was her like,
this was
pattern
a routine
of behaviour in terms
behaviour.
of level of drinking. Yeah,
that's right. So as early as 2020, Kathleen's mother had become aware that Kathleen was ordering alcohol through food and alcohol delivery platforms.
I see where this is. Yeah, this is where you're like, this is going to become problematic. Yeah,
exactly. In mid-2022, Kathleen's mother reached out to her local member of parliament who contacted Liquor Control Victoria on her behalf. This followed a number of incidents where Kathleen was supplied alcohol through delivery services when it was very clear that she was unwell. On one occasion during 2020, she was delivered alcohol while she was still connected to medical equipment.
Oh my God.
Yeah.
There's a responsible service of alcohol. If she's already heavily intoxicated, it's going to be harder to tell in her case because she is a chronic alcohol user, but like...
And it's also interesting, and we'll get to it a little bit later, but my interpretation of the different acts and things that they sort of discuss in this inquest is the responsible service of alcohol sits with the licensee, not with the person who's delivering it.
Yeah.
Right.
Because they're two different entities. You've got the licensee and they're the one who are technically supplying the alcohol.
And so the delivery driver doesn't have a responsible service of alcohol.
This is not discussed in this report, but it was something that stood out to me like a sore thumb.
Yeah, I would assume that they wouldn't because they just have a
Exactly,
package.
but-
They don't even know what's inside it, in theory.
Correct. That's right.
I don't know how this like legal loophole has come about, but I assume that you
We're
might.
going to talk through it a little bit. Yeah.
I get contactless delivery.
Yes.
So you could just leave it at the front of someone's house.
Yeah, but I mean,
a 12-year-old in there.
I can get wine delivered to my house though.
Exactly. But that's a little bit different. That's not fast service of
But also
alcohol.
that is me having a direct contact with the licensee because
Correct.
the winery is selling it to me versus through an app.
where the
You-
app is selling it to you.
Yeah.
They're contacting the
Yeah.
thing and then it's coming back.
The
through
app
the
is third party in that. So like
Correct.
again, in theory, the wine seller knows I'm over the age of 18 because they've confirmed that
Yeah.
when I've ordered it through them.
Which they still don't really do. You just have to tick that box saying I'm
Yeah.
over 18, which,
Or put your date of birth in.
Yeah.
same thing.
If you know how to count, then
Yeah.
So the delivery services would not check her ID and she was visibly unsteady and unwell. So that sort of assumes that in some of the cases there was contact between her and the delivery driver.
but it's not the delivery driver's responsibility if they're not the one with the responsible service of alcohol. Anyway,
But sometimes they would leave alcohol on her doorstep outside of legislation hours as well. So, for example, at 2 a.m. and 4 a.m. in the morning. So,
But you're not allowed to.
well, you're not allowed to sell alcohol. No, licenses don't extend to.
yeah.
I've sort of thought that if the license didn't extend to it, how did the delivery driver get?
Yeah, like as in if
Because they have to get it from a store that is open
Mm-hmm.
and then deliver it.
I don't know the answer
or
to that
they're
question.
pubs or something that are open that late, but their
Maybe.
license to sell the alcohol in theory actually ceased at midnight, but they're still trading or something.
And maybe it takes an hour or so for the delivery
Delivery
driver
driver
at
to
that time
get
of night to
there.
actually get it.
Yeah, true.
Especially because it's like alcohol, like say it's spirits, it's not refrigerated. You don't need to worry about getting it to them.
It's going to be, if that's what
Not
you're
hot
ordering
food.
in the
Yeah.
order.
And if it's multi-delivery where they're picking up several orders and
Yeah.
so they've taken 45 minutes to,
Yeah, true.
yeah.
Potentially.
Which I
But
would not think about as a delivery driver. You decide that I have this job.
that's
You're not going to
right.
be thinking about what time the liquor license had expired.
And ultimately, it's not their responsibility.
Again, you in theory don't know what's in the bag, so you don't even know that it needs a liquor license. Yeah.
The reality is that it happened on multiple occasions that, yeah, she was left alcohol at the front door at all times of night.
And as the really lazy person, I am so appreciative of delivery services and
Me
how
too.
amazing they can be, but I can see.
But in theory, you're not allowed to, you can't get served alcohol at 4 a.m. in the morning
Yeah.
anywhere.
Yeah. So why should you be allowed
So
to have
how
it
can-
drop
yeah,
to your door?
exactly.
Yeah.
Does Victoria have the thing where you can buy alcohol in the grocery store? Because Queensland obviously doesn't.
I don't know if you can anywhere in Australia, can you?
I'm
Buy
not
alcohol in the
sure.
grocery
Oh,
store?
yeah, I thought there was a state.
Maybe that's how, you've got a supermarket.
Yeah, 24 hours supermarket
Do they still sell
alcohol at that
I
point.
don't know. Yeah, not sure. So an inspector of Liquor Control Victoria investigated the actions of delivery services to identify any breaches of the Liquor Control Reform Act. In March 2022, amendments were made to the Act which placed some restriction on the delivery of alcohol in Victoria. So, for example, an off-premise request for alcohol, a licensee must provide written instructions to delivery drivers, including, so they basically notifying them that their delivery does contain alcohol.
Okay.
And in the written instructions, they have to say that this particular delivery must not be left unattended and ID needs to be checked on delivery. So that was a recent reform that was made in 2022 in Victoria
Yeah,
to
interesting.
that act. So now for liquor deliveries,
That has to happen.
whatever delivery service
But again, that's still
driver
not
is aware.
putting them through that responsible service of alcohol requirement,
No.
which I find interesting because, again, you are then making them responsible for checking that ID.
Yeah,
but
it's
then
like they've got responsibility by proxy almost, but like who then gets fined if it's found that ID wasn't checked?
Yeah, but also if you look at an ID and it has no bearing on what the person in front of you looks
Yeah,
like, you know what I mean?
What
Or
do
like,
you do? What do they do in
the
that
kid,
circumstance?
the kid comes to the door and says, "Oh, it's definitely for mum. Here's her ID. She's over age,"
She's just in the shower. She asked me to.
and they've not gone through that formal training that goes through all of the repercussions of what if you do this poorly and the fines that are associated.
Yeah.
And if they do it wrong, like, yeah, again, it's probably not going to go to them because they don't have that responsibility.
Well, yeah, no, it's made clear in the Act that the requirements apply to the licensee and not the delivery driver.
Yeah.
But they are putting this responsibility on the delivery driver. And the delivery driver isn't an employee of the licensee. So also the licensee is going to get pissed off if they get fined for serving underage when they're like, well, I instructed the delivery driver to check.
To do it correctly.
That's not my fault that they didn't.
Yeah.
So it's that weird...
But also the delivery driver has no affiliation with the licensee. Like,
no.
They don't have to do any of it. They're not going to get fined for it.
Exactly. So it's like, what's even the point almost?
Yeah.
So the Act restricts the volume of takeaway alcohol that a licensed venue can provide for an off-premise request. So, for example, no more than one bottle of 170ml wine. So that's something that the licensee definitely can control.
Hang on, no more than...
one 750ml bottle of wine. So you can order a bottle of wine or a bottle of spirits.
Yeah, but that doesn't stop me ordering 10 bottles of wine on 10 separate occasions.
And that's something that came out of this that was never discussed within this report, and I don't understand why it wasn't, is that, yes, you can restrict the volume of one order, but that doesn't stop someone from ordering
several times over.
And yes, you can also use different platforms, but I think there should be some sort of restriction on how many times you can order in one night alcohol from one platform.
Yeah.
As well, but that was never discussed.
But also, hang on, so it's only wine. Does it specifically state wine, or is it like percentage of alcohol?
It specifically said wine. I didn't have a look at the Act. And this was just what was said in the report.
I don't expect you to actually read the full Act.
Yeah.
But it's that concept of, is it one 750ml bottle of wine or one 750 bottle of spirits, which again is going to be very, very different,
so much different
in terms of the alcohol concentration. So that's definitely something that would also need looking at. But presumably you can buy spirits.
Yes.
Yeah.
You absolutely can buy spirits. Yeah. Well, I'm assuming you can. I've actually, must confess, I've never purchased alcohol through a delivery.
I don't think that's a confession.
True.
I also generally am not.
I'm not experienced in this area, so I don't know.
We're very lucky. We're very fortunate that we can drive. And so we can go and drive and get alcohol. And so I get that for some people that's not an option, or they're getting all of their groceries delivered and, it's easy to just get everything delivered. So.
Oh, absolutely. And there are some circumstances where you might want to kick on and you don't have enough alcohol at home and you want to order it. Yeah. I'm not advocating for that, but
that's an option.
That is a better option than getting behind a wheel.
Yeah, absolutely.
So, So depending on the terms of the license held by the licensee, establishments are not permitted to deliver alcohol after 11 p.m. or outside their ordinary trading hours. Again, that says according to their license conditions. So again, I don't know what that means necessarily, but there are time restrictions.
It was probably like a generalized 11 p.m, but say on, is it like Anzac Day or something, you're not allowed to serve around certain hours and these kinds of things. So it's probably just like accounting for that, right?
I'm not sure. And I'm sure there are some establishments who can serve later than 11 p.m.
True.
Yeah, definitely.
As well. So it's just, dependent on what their particular license says. In August and September of 2023, the liquor inspector identified 2 restaurants from which Kathleen regularly ordered alcohol and investigated their activities. For the first premises, the inspector confirmed it had been supplying volumes of alcohol to Kathleen in excess of delivery restrictions, and it was issued a warning notice, so she was able to order more than the 1 bottle of wine.
And so it was coming from a restaurant rather than like a bottle shop as well. Okay.
Yeah, I'm not sure if you can order from bottle shop. Again, I've not tried, so I don't know.
It depends on whether they're like affiliated with the app, I guess.
True, because you can order from like IGA.
Yeah, but IGA doesn't typically have alcohol within its
but I'm saying there might be
Australia.
like a bottle shop that's affiliated in the same way that you can get deliveries from. But again, I'm not 100% sure.
I'm working on it. Oh yeah, BWS first choice vintage sellers all on Uber Eats.
Yeah, there you go.
Can you do a little experiment for me and see how many bottles of
you can add?
Yeah. I can get a 6-pack of Guinness.
I should mention again that this is in Victoria, so
and we're not in Victoria.
Are going to be different.
But this is a litre bottle of wine, which seems like a weird volume of wine that I can put in my cart. I can buy a full bottle of Hennessy cognac. So that's a 40% ABV, 700 mils.
Mm-hmm.
I don't want to spend $84, but I can.
Can you buy 2?
Buy multiple.
Yeah, 2 are in my cart.
I mean, yeah, don't click through, but I'm assuming.
I think this is also going to my actual house rather than where we are now as well. So, like, if 2 bottles of cognac just show up at home, people are going to be.
All right.
Yeah.
Oh, how much is the delivery fee on top of it?
Okay. Hang on. No, I don't want a soda water to go with it. Thank you. Although I probably should. Yeah, I can choose to, no contact. Yeah, leave at location. Oh, can't leave at the door. This delivery option isn't available when your order includes a regulated item.
Yeah.
So I can't leave it at the door. I do have to, in fact.
Does it let you click on what a regulated item means?
No,
or is it just
I didn't.
Okay.
And I'm not going to go through with placing the order, but
No.
it says it'll take 20 to 40 minutes.
Mm-hmm.
I guess if I clicked on it and I wasn't allowed to order that much, then maybe it would tell me.
Yeah, when you're trying to actually place your order. Yeah.
Delivery fee was $7.50. Just to update.
So pretty standard.
Yeah.
There might not be volume restrictions in Queensland, but there obviously is some sort of restriction about leaving at the door.
It would be interesting to try it at 2 a.m. as well.
Yeah.
But I want to stay up until 2 a.m. just to do
But just in case you're up, and you can't sleep.
Well, but I'm really interested, and I'm assuming you don't have that much detail around it, but the 2 a.m. delivery and the 4 a.m. delivery, what time the order was.
No, I don't have any information about it.
And so that, I think, would be the bit that I'd be interested to know.
Mm-hmm.
Because, if it left the premises at 11 and it didn't get to her place till 2, then, where does that breach lie in terms of, because it left their premise within their regulated time.
So they're not a breach of their own liquor license.
Yeah.
So that was in relation to the first premises where they supplied over the volume. The second premises where Kathleen regularly ordered alcohol from, the inspector issued 2 infringement notices for breaches of its liquor license relating to the supply of alcohol outside of licensed hours and in volumes exceeding delivery restrictions. So they're generally aware of these restrictions, but at least at this time were not following their own licenses, which is not great.
Not ideal.
No. So in October 2023, following Kathleen's death, the inspector identified from Kathleen's bank statements that she made orders from one particular food and delivery platform on nearly a daily basis. In the 6-month period leading up to Kathleen's death, she placed 213 orders across 182 days. So it's not a near daily basis, it's more than a daily basis.
A multi-daily basis. But I mean, it could have been 3 orders on one day and none on another. But
that's
I'm also where's the funding for this coming from? Because they're all very expensive, but again, not important.
Know. So of these orders, 98 contained alcohol products for a total of 319 alcoholic products purchased. So she was obviously buying multiple alcoholic products per purchase. So 319 across 98.
Did she order food at the same time or just alcohol? Oh, okay.
Oh, sorry, she must have because 98 orders out of the 213 contained alcohol.
Oh, so, sorry, okay.
So she must
have. So the others contained other items,
Yeah. But that's, still 319 bottles of wine across 182 days that she's been able to order off of food delivery.
Yeah, that's a lot.
That's a lot of alcohol. And that's not including, obviously, the alcohol that she's going in and actually purchasing, which she also does, as we have heard already. Yeah, so it's just showing the ease of access to alcohol and what a problem that is becoming for people who have alcohol dependency because it's just so much easier to access than it used to be.
Yeah.
So during the coroner's report, the coroner sought to understand how Kathleen was able to access alcohol regularly and easily through delivery platform orders. Due to Liquor Control Victoria's investigation into Kathleen's case, the coroner did not seek to comment specifically on the legality of what occurred in Kathleen's case, but more focused on providing general commentary regarding her access to alcohol through these delivery platforms. It was noted that there's been an emerging recognition that food and alcohol delivery platforms have increased the community's ability to access alcohol. According to the Centre for Alcohol Policy Research at La Trobe University, this development is at least partly due to the COVID-19 pandemic, where there was a shift in the availability of online alcohol purchases, which tripled during the first part of the pandemic. The Centre for Alcohol Policy Research has recommended that any alcohol delivery off premises should be by a carrier who's employed by the licence holder. subject to the delivery conditions of the alcohol license.
Yeah.
In theory, yeah, it should be the delivery driver for the
company. You should be employed by the company.
Yeah.
It should be the same
holds
as
the
being
license.
a bottle shop employee
Correct.
at the counter.
Well, I'm thinking more
Yes.
like the Domino's delivery driver rather than it being the third party delivery driver. Yeah.
That's right. They also recommend there should be a delay of at least 2 hours between online ordering and at-home delivery, and the delivery should not be allowed to be made to an intoxicated person.
I don't know if that's necessarily helpful though, because then it's like at the point that it gets to me, I'm just going to scull it then and there, and I'm already have ordered my next one. Like, I think that just encourages binge drinking.
I think the point is more that it hopefully lets people sober up a little bit in between. And if there are volume restrictions, even if you do scull, I mean, if you're sculling a litre bottle of spirits, you're still got to be stuffed either way, or even a bottle of wine for most people, you're not going to be able to tolerate it.
Yeah.
But I think the point is, like, especially for people who do have alcohol dependency, that maybe that gap will let them sober up a little bit and let them reflect.
Yeah, fair.
And maybe stop them from drinking the next bottle. Even though once it's delivered to your door, I understand for alcoholics, if there's alcohol available, it's very, very, very difficult for them not to consume it.
Yeah.
So once it's there,
it's consumed. Yeah.
Exactly.
So can I just add something interesting? So I'm on a website that delivers to Melbourne. I have 3 bottles of spirits in my cart.
Mm-hmm.
And it says here, orders placed after 10:30 by means of delivery will be processed next day at and after 11 a.m.
Okay. Yeah, okay, so that one at least is meeting those...
And is transparent about it. Yeah, the time restrictions.
License restrictions, yeah.
But it is also delivery in 33 minutes. And free delivery.
Okay.
Oh, nice.
So Alcohol Change Australia, a coalition of health, clinical and related services and organisations, noted that late night delivery of alcohol is associated with alcohol-involved family violence, and rapid delivery is associated with excessive and high-risk alcohol consumption. Alcohol Change Australia also emphasised that other alcohol-fuelled harms, including suicide and sudden deaths, occur most frequently at home at night. They've been advocating that changes should be made to regulations to only permit off-premises alcohol delivery between 10 a.m. and 10 p.m. So it all sounds like at least that Go Booze app is kind of sticking to that. I think you said 10:30 and 11, but yeah, similar hours. They've also been advocating for a safety pause of 2 hours between order and delivery. As I said just prior, it's argued that this would reduce the risk of harm by giving people a chance to sober up before deliveries arrive, giving people with alcohol dependence a chance to cool off and an opportunity to decide not to consume impulsive alcohol purchases. The coroner agreed with these reports and noted that these seem to be areas that are relatively straightforward in terms of being able to enact some sort of reform that has the potential to significantly reduce harm to people, especially those with alcohol dependence and, their ease to access of alcohol. The coroner noted that she regularly encounters the fatal consequences of alcohol use in the community as her role as a coroner. Each year, more than 150 deaths involving the acute toxic effects of alcohol are reported to the Coroner's Court of Victoria. At least another 100 deaths per year relate to the chronic effects of alcohol use. However, these deaths only make up a portion of all alcohol-related deaths, as most deaths resulting from chronic alcohol use are not reportable under the Coroner's Act, as they are largely considered deaths by natural causes. So yeah, it's obviously a huge issue in the community. To explore what can be done to address the death toll relating to alcohol use in Victoria, the coroner analysed certain deaths that she was currently investigating, in which the person prior to death had engaged in alcohol use for an extended period and the death was a direct result of alcohol consumption. However, from the materials, the coroner was unable to identify any meaningful commonalities with the deaths relating to the people because they had diverse socio-economic backgrounds, diverse patterns of use, diverse mental health histories and histories of engagement and with treatment of alcohol. So basically it's a problem that affects a broad spectrum of people, and you can't just say it affects people who are particularly wealthy or particularly poor or of a particular background, race, religion, etc. It just is something that's
gender, occupation.
Yeah. They also died in diverse circumstances related to their alcohol use as well.
Because I suppose some would be like Kathleen, the acute
yes,
toxicity, but then some like car accident.
Well, FG and
Nathan Macri. That's still counted as death related to the consumption of alcohol. So, yeah, absolutely. The coroner then looked at what inquiries and reviews have been done by the Victorian and Commonwealth governments to address alcohol-related harms to identify any potential prevention opportunities. The coroner identified 5 relevant inquiries published between 2006 and 2019. In reviewing the materials, the coroner found that despite these initiatives occurring over a 20-ish year time span, there was still a high degree of concordance between them about what needs to be done to reduce alcohol-related harms. So basically, there's been 20 years, there's been several reports, and they're all kind of saying the same thing about what can be done to reduce harm, yet have we actually been doing
any of them?
Any of these things. And obviously, like, these reports were up until 2019, and then we had the COVID pandemic, and then so this is slightly different to that.
But also,
but still,
we saw, what do you say, it tripled, online sale of alcohol tripled as well. Yeah. So again, that probably wasn't predictable.
No, I mean, COVID wasn't predictable.
Yeah, and that consequence of COVID.
Yeah. It was probably going to happen anyway. It just was sped up because of the pandemic.
Yeah.
I think. So the following were the areas that were consistently identified across each report. So first of all, pricing. Alcohol prices influence risky alcohol use, and changing the price of alcohol is likely to reduce the harms of alcohol use.
You say that, but we're one of the countries with the highest cost of alcohol per percentage alcohol content, right?
Mm-hmm. I don't know, but I wouldn't be surprised.
We have a very high tax in comparison to a lot of other countries that I know of. And so the same is seen with cigarettes, that yes, technically the more expensive you make them, the harder it is for people to purchase it. But I don't think it makes them stop.
No.
It makes individuals
a lot of the time go into more debt
or avoid other necessary life costs in order to get the thing that they are addicted to.
Mm-hmm.
So they will stop eating.
Yes.
Yeah.
I get that it makes it harder, but you're also then making them even more likely to have other deprivation in other areas.
And it's something that was discussed in this report that I haven't gone into because I didn't think it was necessarily relevant, but it might go to that point of Kathleen spending a lot of money on alcohol, obviously, is that she did have an eating disorder as well.
Yeah, right.
So she wasn't eating enough.
Yeah.
And she had gone into treatment for that as well. So she also had like an addictive personality as well. And on that point of taxation, that was another common theme across the reports, that different types of alcohol products are taxed differently in Australia. So some alcohols like beer and spirits are taxed proportionately according to alcohol content, as you said. But other products like wine are taxed based on price. So cheaper wine products are taxed less than premium wine products, even though the alcohol content of the wines might be the same.
Doesn't make a lot of sense. Affect the consumer though?
Well, yes, it means that you can buy a lot cheaper bottles of wine.
Right. Because they've typically got less tax on them than if you buy a really expensive
bottle of wine.
That's why
you can buy like a $6 bottle of wine.
Yeah.
Whereas you wouldn't be able to buy a $6 bottle of spirits.
Yeah.
And you're not able to buy a $6 6-pack beer.
No, because it's based on the alcohol content rather than... Where wine can be quite high alcohol content.
Yeah.
If you're looking to drink a lot of alcohol at a low price, you would pick wine.
You'd go for Goon. Another point was regulation. So the way alcohol is made available is subject to various regulations. Some areas of regulation, including density of venues, times when alcohol is available, ways that alcohol can be purchased, training for staff serving alcohol, and permitted types of alcohol promotions could be changed to lower the risk of alcohol harms.
Like we obviously, Australia, I think as a whole, said that we can't advertise alcohol during certain times on TV.
Mm-hmm. Yeah.
And like during, sporting events, like there used to be, on a slight tangent, we still allow lots of gambling ads.
Yeah.
Yeah. Another point is healthcare. So it's critical to ensure appropriate treatment is available in a timely manner to people experiencing alcohol dependence or other alcohol-related health issues. And of course, early intervention is beneficial. Advertising, as we just said, there are links between advertising and other alcohol promotions and harmful alcohol use. Advertising restrictions may limit exposure to alcohol. Product labelling. Alcohol drink containers can be used to promote health information about alcohol consumption. Education for young people. So evidence shows that education programs delivered to young people in schools may assist with responsible alcohol use. and community education. So negative impacts of alcohol use within the community may be addressed by taking action to increase general awareness about individual, family and community harms associated with alcohol consumption. So that's sort of the key themes that came out of all of those reports. The Victorian government announced in April 2024 that it would develop a new 10-year strategy to address alcohol and other drug harms. At the time of the inquest, initial work had been undertaken, including early stakeholder engagement. The coroner commented that this could be the vehicle for developing a program of work in relation to the areas identified. However, the scope and outcomes of the strategy are yet to be confirmed. The coroner couldn't comment really any further, but made relevant recommendations in relation to what could be included
in those, in terms of like, okay, now you're doing this review. Well, here are some things that have been found in inquests. Like, please consider adding them to your review or making sure they're highlighted.
Yeah, that's right. And that's really the bulk of what this report was about. And I should actually say it wasn't, I think I've actually referred to it a couple of times as an inquest. This is a coroner's report without an inquest, but it was obviously something that was very topical and so was picked up by the coroner, and she did some investigating around this death and what's been done and sort of what's been done in the space of alcohol delivery and things like that. So the coroner made 3 recommendations in relation to this report. The first was that the Secretary of the Victorian Department of Justice and Community Safety consider amending the Liquor Control Reform Act, along with any required regulations to prohibit home delivery of alcohol between 10 p.m. and 10 a.m. in Victoria. So restricting the hours of alcohol delivery to during the day up until 10 p.m.
Which it seems like Alice has discovered is not technically quite there. Yeah.
Also, remember, this report only just came out like 2 weeks ago, so there's not going to be...
Yeah, I forgot. Yeah, nothing will have actually been actioned.
No,
obviously.
That's right. It's only been 2 weeks.
Yeah.
Give it a couple of years.
Yeah, I will see. But it was close to those hours. It wasn't far off. The second recommendation was that the Secretary of the Victorian Department of Justice and Community Safety consider amending the Liquor Control Reform Act, along with any required regulations, to require a minimum 2-hour delay between order and dispatch of alcohol for home delivery in Victoria. So again, we've sort of talked a little bit about that pause between, order and delivery and how that might assist people who have alcohol dependency and potentially reassessing their actions in that time and, stopping from allowing them to just constantly order and order and order.
Yeah.
But are the companies who are supplying the alcohol necessarily going to be happy with that? Because that then loses them a sale.
It does.
If you want it immediately and you have to wait 2 hours, you might just say, well, I'm just not going to bother.
Yeah.
It's going to impact their profit.
It depends on how much they're going to lobby against that potential change.
And it sounds like they are profiting a lot off of this online delivery as well. But again, it's only a recent profit, right?
Yeah.
So they survived before and they'll survive afterwards.
Well,
I'm sure.
You say that, but I reckon a lot of companies might have then started since.
Yeah.
That's fair. The final recommendation is that the Victorian government develop a new alcohol action plan and a program of work, including specific actions, timeframes, accountabilities, and public reporting on implementation and evaluation to address alcohol-related harms in Victoria. So they're already really doing that.
With their review. But also it sounds like they've had many reviews over many years and then...
Not a whole lot has happened. And then, of course, as we said before, this is a new issue. That's really come through. But yeah, as I said, I thought it was quite interesting that there was no commentary about restricting the number of orders that a person can make of alcohol delivery on a particular app. And yes, I understand there are going to be multiple apps and so it might not be
it might just be
as effective.
No, because even if you just do it, like you can only have 1 order per day off the app or whatever, then you've got to cycle through, 10 different apps.
Exactly. So
that does make it harder.
It's putting a barrier.
Yeah.
Even though it's not a high barrier, it is still a barrier that might disincentivize people from doing it.
You would then need to have limits on the amount that you could purchase in 1 order, though.
True. Yeah,
well, they already do, technically in Victoria, at least. And again, I don't know what sort of liquor licenses apply to restaurants versus bottle shops.
Yeah. And her death was in 2023,
yes,
you say? So I wonder if that's a change also that's occurred in the last 12 months in terms of more bottle shops have signed up.
Mm-hmm.
Maybe there were only, or whatever area she was in might have been that really only restaurants were the only supplier.
Yes.
Whereas that supplier aspect might have changed even in that period of time.
Yeah. And it seems like she was purchasing from restaurants. And again, even on the night of her death, it doesn't actually say whether she ordered alcohol at all. Like, it didn't go into any of that, but I think it was kind of almost just assumed that she
I just
did.
would have thought they would have checked that to see, okay, after her mum went to bed, when she thought she was gone to sleep, she had gone to sleep.
Yeah.
Did she then wake up at 1 a.m.
And order alcohol?
Order something, have it delivered, and then?
Don't know. It didn't go into it at all.
But I guess the mum might have not caught her in the act, but like come in just after she consumed the half bottle. She was still rousable at that point, taken it away, and then that half bottle still could have been the thing that pushed her over the edge. But
something stashed somewhere.
Yeah, they didn't know about or whatever.
Yeah, exactly. So we don't know that either. But yes, it's an issue that's obviously becoming more and more prevalent as we move along and move on to sort of online services and things like that. And so it's an issue that is going to continue to occur unless there is some sort of governmental intervention. And of course, it seems like liquor licensing and licensing laws are all state-based and not
always
Commonwealth-based, which means some states
are going to be behind.
And the landscape in some states is going to look very different than others.
South Australia being so conservative, it means that their liquor licensing regulations are probably in front in the sense that the timeframes people are allowed to buy alcohol are probably less hours of the day and that kind of thing to other states.
I wonder if we'll ever get to the point where it's just that you're not allowed to order alcohol from a delivery service. Because it's not a necessity. It's not like a food delivery, grocery delivery where you may need that because you can't.
I think people who argue the freedoms of the individuals that believe that they can control their alcohol intake or that they have the right to order.
Yeah, should they be affected detrimentally? Yeah.
But again, delivery of alcohol is not a new concept. As we mentioned earlier, we can still bring up a winery and get a bottle of 12 delivered to us. It just doesn't come today.
Yes. Yeah, I guess it's the immediacy.
Because
it's normal to order from a winery and it takes like a week to get to you.
Yes.
Yeah, so
it's I need alcohol now.
I am already too intoxicated to leave the house.
Yeah.
To drive somewhere to get it, and there's nothing within walking distance, or I can't walk there because they'll know I'm intoxicated.
Yeah, so maybe more than the 2-hour delivery time frame. It needs to be next day delivery.
Yeah.
But again, that's detrimentally affecting people who are using alcohol responsibly.
Or I think the delivery drivers need to have the higher level of responsibility where...
Yeah, or restricting and saying, no, you cannot purchase alcohol off of these third-party apps, but yes, you can purchase alcohol from a bottle shop who does delivery.
Yeah.
Because then they're trained in their RSA.
Yeah.
Your ID, they won't serve you not visibly intoxicated.
Yeah.
And that's not necessarily detrimentally impacting the bottle shops then. Yes, they'll have to employ an extra person maybe to do deliveries, but they can then charge higher delivery fees.
Yeah, and that also, again, would reduce your willingness to buy it if necessary.
The current system they've got in place where there's no liability on the delivery driver.
Yeah.
Just doesn't make sense to me because that's such a loophole.
But then if you were signing up to do a delivery driver service, would you want to have to then go get your responsible service of alcohol at the same time?
No. It's an interesting topic, and I had a quick look at some of the articles, as I said, that reported on this particular finding, and there were a lot of spokespeople from various stakeholder groups that spoke out in support of the recommendations. A lot of sort of alcohol associations and those sorts of things, as in like alcohol prevention and harm prevention and things like that, not like bottle shop lobbyists. And also certain GP groups and medical groups and things like that spoke out in support as well. So I think it's something that it's very much a watch this space in the next couple of years to see what happens and see what develops.
And I hope something like a good solution is found because, that's going to be hard.
It's going to be hard, but as the coroner commented, like implementation should be pretty straightforward in that it's not going to be difficult for delivery apps to be restricted in some way. It's just like actually finding a ground that works legally, but actually implementing the change won't be
hard. Okay.
yeah, you can see how these delivery services and access to alcohol like this can be so detrimental to some parts of the community as well.
Absolutely.
Really, really detrimental. But I think that's it from us for this episode. So thanks so much for listening in. We appreciate it. And yeah, if you do want to have a bit of a play around with some different delivery service apps and see what you can find in terms of
ease of access and
what you're restricted to doing, let us know. And yeah, we'd be keen to hear about it. Thanks, everyone. We'll catch you next time. Bye.
Bye.